Hello, my name is Cynthia Kelly. Today is March 29, 2018. I am currently completing my internship in the spring semester at R.J. Blackley Alcohol and Drug Abuse Treatment Center. R.J. Blackley is a state-funded inpatient substance abuse treatment center that serves the residents of 25 counties in central North Carolina. Thus far in my internship, I have observed, assisted, and independently completed intake assessments, wellness and activity groups, and one-on-one treatment sessions. Some things that I have accomplished during my internship are learning how to effectively complete assessments, documentation, and facilitating treatment sessions independently. For the first 2 weeks I was here, I was nervous about leading assessments and would leave out pertinent information that needed to be noted, such as how long the patients have had a substance abuse problem and what led them to begin. When I did this, we would then have to go back and look in their chart to get this information. But by the third week, I was more comfortable with leading assessments and taking the correct notes. I have also been able to pick interventions that coincide with the patient's goals and facilitate those interventions independently. The first objective I set for myself was to be able to properly document assessments and treatment sessions without needing assistance from my supervisor by week 10. I was able to accomplish this goal for myself earlier than I expected through practice and repetition. Another objective I set for myself was being able to get the patients more engaged during our wellness group and treatment sessions by the end of my internship. This was something that I struggled with in the beginning, but this is also an objective that I am proud to say I met. Some of the patients are not as outspoken as their peers, so they would respond with one-word answers. So what I would do is go to a certain topic on the paper we were discussing and guide the question more towards that subject instead of making them answer the broader question. Once I did this, the patient was more open to discussing the topic. A surprise that I've encountered during my internship is how quickly our number of patients can drop and rise back up again. We would have a high census, then within a week, we could have up to 10 patients discharged to either their home, a hospital, or a long-term treatment facility, and then have 5 or 6 patients admitted. This is something that I quickly realized will change constantly. R.J. Blackley focuses on getting patients connected with resources in their community that can help them continue their recovery. Prior to discharge, all patients are provided with an outpatient aftercare appointment and given resources about support groups, counseling, leisure resources, and community involvement opportunities around their home. A piece of knowledge that I utilized from ECU was documentation. At ECU, we practice writing documentation notes from watching videos and writing only important details. This is something that I've practiced while being here at R.J. Blackley. One thing that stands out as being helpful from ECU is being creative with interventions we choose for the patients. I believe creativity is key with these patients when introducing them to different interventions to help them with coping skills, because you want them to remember and utilize them when they are discharged. I want to thank my agency supervisor, Dylan Lell, for taking me as an intern this semester. I also want to thank Ms. Burnworth for taking the time out of her busy school schedule to be my internship supervisor. If I had to give any advice to future interns, it's to take as many notes as you can during the beginning of your internship so that you can utilize them throughout the internship. Go Pirates!